Welcome, everyone.
All right, and we just wanted to give a brief outline of what we were going to cover today. So we'll start with just an overview of this lovely survey that we are featuring today. So what is this community food survey? How was it created? And then why did we create it? Then we'll really jump into the meat of the survey results. And then once we've reviewed that, we'll go through what we're calling the implications and observations, really looking at the strengths and the challenges that were represented in the data. And then based on some of the findings from the survey, we wanted to share some community resources. And then after that, we'll leave time for questions. We're hoping to keep kind of the content where Dr. Angie and I are talking to about 40 minutes and then leave about 10 to 20 minutes of discussions. At any point, you guys can put questions in the chat and then we'll get to those at the end. And then, the most important thing, what is this survey that we're speaking about? So the Western UP Community Food Survey. This was a survey that was sent out in the spring of 2022. It was funded by Copper Shores Community Health Foundation, again, formerly known as the Portage Health Foundation. And it was conducted by researchers at Michigan Technological University, MTU, in partnership with the Western UP Food Systems Collaborative, also known as WUFSCA, which took me probably 3 years to commit and say correctly. So I did it. I'm here. For those that are unfamiliar with WUFSCA, I know a lot of people on this call are part of that group, but that is a grassroots coalition of a variety of community members, including scientists, community advocates, growers, educators, land stewards. Really anyone who's interested in food or food systems is welcome to join, and we are all about supporting our local food systems. So that is what that group is about. And then this survey included 4 major sections. So we looked at food sources, food access, some demographic information, and then food programs.
So the survey was created through a process that originated within the Western UP Food Systems Collaborative. A number of you were involved in this process. We realized that we needed information about our community if we were to be doing more programs and policy interventions and things within our community, that we needed data, our own data about ourselves. And so we looked to literature, we looked to studies that had been done in other rural places, and we found that rural food systems are really understudied. A lot of the attention is focused on urban food systems in cities. And so there's really not a lot of knowledge about rural food systems. But we were lucky to have the assistance of Dr. Kelly Cam, who helped with funding through WUPIDR to create a question bank drawing from USDA Food Security assessments that we were then able to revise and make this into something that would be just several pages long to send out to the community as a survey. And so we tested and piloted the questions throughout 2021 with a lot of community members. And so their feedback is part of this survey as well. Before, as Meghan said, we implemented it in spring of 2022. So to our knowledge, this is the first empirical region-wide food system survey of Western UP residents. And when I say the Western UP, I'm talking about the 6-county region that is served by WUPIDR. So Iron, Gogebic, Houghton, Keweenaw, Ontonagon, and Barnegat. And there has been surveys like the USDA Food Security Survey or the Community Health Needs Assessment, or Feeding America has data as well. But this generally has very limited questions about food security. The Community Health Needs Assessment has 1 question about food consumption. And it's not always specific to these counties or our interests. So it's really great to be able to create a survey that was specific to those interests of ours that we've been hearing from community members. Also, this is really important because now we have a baseline from which to assess change in our communities, and we'll be able to follow up on some of these questions. We really hope that maybe some other community partners and organizations might want to use these questions in their own assessments, and then we can better see what change we are actually making in our communities.
So with this in mind, we had some goals with this survey. And really, as I walk through these, I would say like the overarching goal was really to get a fingerprint of each community as well as the 6-county region as a whole in terms of food access, food procurement, and all these things. So as I'll walk through kind of each section. Really the first one we wanted to look at was food procurement patterns. Really, when we think about our region being rural, having a lot of access to the woods, to the water, we wanted to really capture how people might be procuring food, whether that's themselves, bartering, these sorts of things that aren't always captured in generic food surveys. And so that looked at informal and formal food pathways. We also wanted to look at our social, cultural, and economic aspects of food access and practices, again, unique to our region. And with that would help us identify key areas of intervention, like farmers market support, food in our schools being local, these types of elements. We wanted to gauge for each community, and again, as the region, what kind of support do the residents actually have? And then that would lead us to have a better information to share about current and future community health policy. Are we meeting the needs of our residents? And if we are not, where's the data that can show us how we can make those steps?
Yes. And so the data was collected through a mailed survey. So there was a sample of folks that received this yellow survey in the mail, using best practices for mailed surveys. And we did that with the intent of trying to get respondents from every county. We bought a data sample list from a national company. And so these are people who may or may not have any interest in local food systems, but for whom we were interested in just, trying to get this baseline data about how they are involved and what kind of activities they're engaged in. We also had an online survey through SurveyMonkey. And so this was available for anybody who wanted to take part. A lot of folks that completed that survey already were interested in and passionate about local food systems. They sought out this online survey because they wanted to share their input, their ideas, and these kinds of things. So we had those two different modes of survey implementation, and it was open in the spring of 2022. And then following the completion of that data collection, I worked with Dr. Hongmei Liu, who was then a postdoctoral research associate at Michigan Tech, and we aggregated and analyzed this data. And so we were looking for important patterns. We were looking for just at the very basic level, like descriptions of who's involved in our local food system and why, because we didn't have that very rooted in place data before. And then we also analyzed for statistical significance. So to see if there were certain variables, for example, distance to grocery stores or winter weather or engaging in the actions of preserving food that were significant in helping improve food security.
So the how will this data be used? The first and foremost is really just to celebrate our area and the unique characteristics of our food system. There's a lot of really wonderful, positive information about the things that we're doing well. And we want to celebrate and share that information out. It also can be used to inform grant writing. As we mentioned, there's going to be a lot of data that will show there's a lot of support within regions for various food engagement. And this will better support that effort. And that kind of goes hand in hand with informing policy. Again, whether it's maintaining a policy that might be supporting or looking at ways in each community that maybe support in policy is lacking. Again, providing data for those individuals or those communities to use to better support local food system engagement. This next point, supporting data justice, we really wanted to be able to have our own data that reflects our own community, but also to have this open access, whether it's people wanting to utilize just the data points or actually use the survey instrument itself and tweak it and modify it so that they can follow up and do their own studies within their own subset. And we'll talk a little bit later about how you can access that information as well. And then lastly, we really want to support continued place-based knowledge creation for our own communities. Again, we wanted to really tailor these questions with the input of our partners, with the help of Dr. Kelly Cam and Wippeter to kind of create that original question bank, but really to look at how we can get a snapshot of our unique community and then continually use that information.
And so we have some survey highlights that I'll be sharing with you. We don't have time today to talk about all the interesting things that we found. We will welcome follow-up conversations. I'd be very glad to meet with folks to talk more about this and share data. Meghan would too. So reach out if you want to get deeper into some of these results. So the result also that I'm sharing, we've combined the online survey and the mailed survey data for these results. And so the first thing that we were really excited about in our survey findings was the level of engagement that residents in the Western UP have in our local food systems. And so we measured this by asking them if they participate in the activities in the column on the left, growing vegetables, raising livestock, hunting, fishing, or foraging for food. Because we know sometimes people do some of these activities for recreation, but that doesn't necessarily tell us then if their hunting or their fishing or their foraging is also supplementing then their diet and their procurement of food for their household. And so we were interested in that from that food consumption aspect. And you can see that there's very high rates of engagement across our regional food system in these activities that often are called informal foodways, because people are doing this outside of the formalized food economy of using money to go to the grocery store and buy food. They're growing vegetables and, trading zucchinis across the neighbor fence. They're hunting and sharing venison with family members, engaging in these informal types of sharing and trade and bartering. And so this is a really high level of engagement. There's not a lot of data to which to compare this because most of the data asks only about those formal activities, like how much money do you spend on food at the store and that kind of thing. And we think this is important and that we need to take care not to miss this. And this is why we included this in the survey, because it shows the connection of land to people's connection to land and place where they live. It shows our relationships with where we live and the really unique cultural characteristics of this region where we have long-rooted immigrant and indigenous foodways here. A lot of knowledge, right, about local plants and animals and care for these things and our relationships with these. And so this is very important and unique data that we're excited to share. We also were excited and glad given our interests as researchers and educators and organizers and planners, that there was a lot of support for community food systems infrastructure. And by infrastructure, we're talking about, it could be physical, but it could also be social, the places in our community where we can engage in food systems activities together. So farmers markets, community gardens, professional kitchens, also things like public transportation that maybe traditionally people might not think is part of food systems infrastructure, but it's really important for, getting people to farmers markets or to grocery stores and these kinds of things. And so you can see that across the 6-county region, a very high support for all these different activities. I think that this shows recognition that even if people are not participating in these activities themselves, for example, maybe they don't want to spot at a community garden because they have a great garden in their backyard, that they recognize the importance of these things for community making where we live. So this is really important for our local elected officials and planners and people in our community to be aware of as they're making plans for our towns and counties. And then the last trend I'm sharing here is about food insecurity. And so this is one of the known challenges in our area, that we know that we have high rates of food insecurity. It's not a surprise to us that SNAP, the Supplemental Nutrition Assistance Program, is underutilized across the 6-county region. We were able to assess from our respondents how many people would be eligible for SNAP based on their household size and their income, but are not currently using it. And so we can see now from our respondents just how underutilized SNAP is in our region. And this is important to note because there are programs that SNAP eligible participants can use, like Double Up Food Bucks, which are big win-wins for people across our region. For example, getting to use their Double Up Food Bucks dollars at farmers markets is beneficial for the SNAP recipient, but also for the business of our local farmers and is an economic contributor, right, in our communities. And so it challenges us to think more creatively about how we advertise these programs, how we work to destigmatize these programs and make people aware of the big impact that they have across our community, to recipients, of course, but also people beyond the recipients.
One thing I wanted to add to, Angie, that I thought was really interesting in the survey results is we had some people that had selected that they weren't a part of SNAP or weren't interested, but were interested in something like Double Up Food Bucks. So again, I think that showed that there is also a discrepancy in knowledge as well of what programs are. And people might be more open to something like that program.
Yes.
But they don't know it's necessarily SNAP.
So we have work to do. We knew that, but this helps us tailor that work in ways that'll be most impactful, right, for our community residents. And then we included this question, travel more than 20 miles to the grocery store, because this is a standard federal measure as a contributor to food insecurity if people have to drive 20 miles or more to the grocery. And it's not a surprise. We see Houghton County, for example, is pretty low in percentage of respondents who report this, because we know we have quite a few grocery stores here in Houghton County. But counties that maybe have lower population density are more geographically remote, like Keweenaw County, Ontonagon County, much higher rate of people who are reporting that they're traveling pretty far to buy groceries.
And then up next, we wanted to highlight, I'll show this one. We have an example actually for every county. So those 6 counties that Dr. Angie mentioned earlier. So the data that Angie just reviewed was looking county by county, side by side. These are fact sheets that our lovely graphic designer, media specialist, Adam Campbell-Shusky. So if he's on this call, thank you, Adam. He put in a lot of hard work and tears into these. But we really wanted to create a fact sheet that our community partners in each community could use. Again, this isn't exhaustive in terms of the data, but it goes through the food engagement. So again, looking at those informal food pathways, infrastructure support for food systems, food insecurity. I didn't include any snapshots of the backside, but on the back, it has kind of like the key takeaways and resources to link. And we'll touch on some of those resources at the end. But Adam did a wonderful job, and this will be really helpful for people to just have a nice visual to look at and get some of this really important data for each region.
Yes, and they are available, we'll show you at the end, for download now from the Portage Health Foundation's Food Initiative website.
Yes.
And these are, very brief summaries of the highlights that I've just shared. We have much more data, a lot of data that we're eager to share, depending upon how people want to use it. We can help you in different ways to use it. And so we also will share the form that we have where you can request different parts of the data, perhaps different questions you want to look at to see and learn more about those trends. So we also had qualitative responses to the survey. Primarily the data was quantitative. People were answering questions or basing things 1 through 5, giving them scores. Most of the questions in the survey were quantitative, but even those quantitative questions had spaces where if people wanted to elaborate, or maybe they had said, they do something another way that wasn't listed and they wanted to explain. And very importantly, at the end of the survey, there was a question box where we said, if there's anything else you want us to know, here's a space where you can write out some more information for us to learn about your situation. And so those are places in surveys where you get some of the more rich how and why things are happening from people's unique standpoints and situations. And so we also coded this data, although not all respondents shared this level of data. So some of the trends here were that access to a variety of fresh food was very important to respondents. Freshness everyone said that was a really high thing that they were thinking about or conscious about when it came to trying to find food. I think 95% of our respondents. And so this is also a challenge, though, because we know if people are driving 20 miles or more to a grocery store, then it might be a challenge to get a lot of fresh food because that may not store as well as shelf-stable food. Also, fresh food is more costly, and especially in the time that we did this survey and since, we've seen food prices have been really inflated. And so understanding that people really want fresh food and want access to fresh food, but they're limited because of the price of the food or the distance, or maybe their local grocery doesn't have a very good selection of fresh food. Maybe it's not very fresh there. That this is something that we need to work on, that we know the interest is there, but the access is not for a variety of reasons. And so this person said there's a lack of organic and diverse or fresh or even canned frozen food at their grocery. Our one local grocery store seems to try, but even the basic items are priced too high to get often enough, especially so right now. The locally grown items seem to be priced okay, but the selection is limited. And then another trend we saw in the qualitative answers was the importance of self-sufficiency to a lot of our respondents. Many people commented about how proud they were, or glad they were that they were able to hunt, fish, garden, forage to help contribute to their household's food supply. So this person, I'm lucky I have never had food insecurity, partly because I grow a lot of my own food. And so the contributions of these informal foodways are really important to food security in our region. At the same time, the self-sufficiency, like all of these are kind of a double-edged sword, can be a challenge, because if people do experience, for example, changes in their housing or their job situation, or for some reason aren't able to participate because of health or ability in these informal foodways, they may feel like it's the stigma of reaching out for food assistance. So it's good that we have a lot of self-sufficient folks, but also the importance of community and community care and abundance in our food systems. It's something that we need to work to build into our education and our programming, so that people understand that, not everyone can be self-sufficient, and community care is really important for a healthy food system. And then, no surprise, cost. As I said, the fresh foods are often more costly. This person noted groceries are way too expensive, and those people in the working class don't qualify for any assistance, even though the cost of living has increased tremendously over the last couple of years. And so people are really feeling that pressure. Many people haven't had cost of living adjustments in their salaries. And so even if people are employed and employed well, they may feel like they're cutting costs when it comes to buying food, that's a place where they can do that.
So kind of reviewing everything that we've talked about, we really felt like the strengths that came out through this survey really looked at our unique history and our relationship that our residents have with the land. There's such a high engagement with informal food pathways, again, things like gardening, foraging, hunting, and fishing. And there's also a very strong support for improving local food system infrastructure. And those two things combined really presents an amazing opportunity for us to use those strengths to better support our community food systems together, really honoring our cultural traditions and all of this wonderful place-based knowledge that exists. So it's such an amazing thing to see that in numbers too, right? I think a lot of people, especially in our food systems bubble, might know this information, but now we have data to support it.
And we have had studies. I saw Courtney Archambault was on the call, her studying double up food bucks access at farmers markets. And we've had other Michigan Tech students who have done research studying local food systems infrastructure for farm to schools. But now we have this regional, across the 6-county region, study that we can use to help inform and guide future work. Also, I'm primarily a qualitative researcher. I recognize that people put a lot more strength or belief in numbers and the quantitative data, maybe more than they often should. But it's great now that we have that quantitative data, right? And we have those numbers to lean on to complement our qualitative data that we've been doing. So, we hope that this is of use to the people applying for grants, people organizing programs. Yeah, we're very excited to have this.
So some of the challenges in terms, specifically of food security that we found through this survey, which, and again, a lot of these won't necessarily be surprising. Economic, or again, cost, just the physical cost of food is one of the primary issues. I don't think either of us have an easy answer, though I know everyone would love that. But it was a challenge that was repeatedly brought up in a strong pattern. There's the physical challenges. We are such a rural location. It's just hard for people to get access, and that is inherently going to be linked with food insecurity. There's the cultural challenges, and well, I think in the next slide I'll talk a little bit more about that. But our culture also plays into food access and how we engage with more of those formal food programs. And then kind of piggybacking off of that, even for those that might be more open to participating in those formal food pathways, it's hard to do. There's a lot of burdens for people to participate, which often leads to decreased engagement as well. And so those are all challenges we have to continue to keep at our forefront and figure out together how we can work to address it. So some of the other, bullet points I just wanted to expand on, when we're looking at our unique area, another economic impact would be our utility costs, especially when we're looking at winter. That often would eat into the food budget for residents that responded to these surveys, which again is not necessarily a surprise for anyone living here, but is again good for us to note. I mentioned the distance from grocery stores is a major challenge, as well as transportation, limited transportation options for people that may have a hard time getting into town. Our culture up here, Yoopers are tough. I don't think anyone would deny that. And we have a strong culture of self-sufficiency, and there's a lot of strengths to that. But in terms of engagement with some of these, food programs or getting help can be hard. And there's also a perception, and this came up a lot in the qualitative responses. Well, I'm not in a great position, but others are worse. Others need things more than me. And that's a common mindset of rural communities as well. And we certainly saw that reflected. Mm-hmm. And then that participant burden, as I mentioned, it can be burdensome. It can take time and knowledge to know how to navigate, how to even find out if you're eligible, and then how to enroll. People may not be aware that a program either exists or that they're eligible for it as well. Again, that Double Up Food Bucks example would be a prime example of that. And then there's the stigma of receiving assistance, both for formal and informal, that is a burden for people. And then we wanted to touch on some community resources, especially after highlighting the challenges. We don't want to leave anyone feeling bummed out. And so we wanted to kind of show this certainly, again, is not an exhaustive list, but it gives some places to start. So this first resource here, phfgive.org/food. This is where you're going to find all of the community fact sheets for this survey. And there you just click and you can download. And you can do with that however you please. There's a Google form if you would like to access the survey data or the actual survey instrument. You would fill this out, and this is really just for us to get a snapshot and capture how many people are using this or want to utilize it. So that's really all that it is. And then once this webinar recording link is available, we'll add that too, so you can share or refer people that may have wanted to attend this, that might be a good partner in some of this work. You can just refer them to this website, and they can get links to their webinar as well. We also wanted to highlight Upper Hand Health and Community Resources. This is a wonderful resource. One second. I think you can just go back to, present, and then you should be able to click. Perfect. So Upper Hand Health and Community Resources is a wonderful place to refer people as well. As you can see, it's not specific to food, but they are constantly updating. I believe Dr. Kelly Cam's students consistently update this information. And so you can click any of these categories, and I believe you can then tailor it, to your community. And it will provide information or websites for you to get plugged into these various resources. So Upper Hand Community Health Resources is another really great avenue to look for. Our local food pantry, BHK Community Action, they have a food pantry or a food program section. under that program up at the top. And this can give you some more information on that as well.
Mhm.
Feeding America is a really great resource, whether you're looking for data or to actually find things. They have a whole section on finding free food and groceries. It's a wonderful website. I would highly recommend you refer people there for help as well. And then there is a hunger hotline put on by the USDA as well. And so you can dial that number or text it, and someone will be able to connect you to get resources and get plugged into any food programs that you may be eligible for. And then last but not least, we wanted to share there is a grassroots group called Growing from the Heart locally, and they did a wonderful job reaching out to local food pantries that would be willing to accept fresh produce. So this is an updated list for 2023. And it gives business hours, where they're located, what kind of produce may or may not be available. And it is a really great resource to share out for those that are looking for fresh produce. That's another big struggle that came out in the qualitative responses, was that, especially for those food access points, it was hard to find fresh food. And so this is a great way in this growing season, especially, to be able to support each other. And with that, we are open for questions if anyone has any.
Yeah, feel free to unmute yourself or drop your question in chat. If you want to raise your hand, we've got an eye on the participant boxes. Yeah, Rachel.
Yeah, I have a question. I have a question for Meghan. Meghan, does Copper Shores Community Health Foundation have any plans to utilize this data to go after grant funding or future programs?
I think it will be a good guiding point for us to utilize, as well as other groups too. I mean, that's the whole point, and certainly not just for us, though. Of course, we did fund it so that it could better inform whether it's direct grants, or supporting our partners that are doing this work. So absolutely.
Thank you.
When you guys found that there was high involvement in informal food pathways, were you comparing it to other regions or other states, or?
That's a good question. There's not a lot of data to which to compare it, because most food security surveys ask about the formal economy and the formal food pathways. There has been some research done by a rural sociologist, Mary Hendrickson, in rural Missouri, where she talked about the importance of informal foodways. But there's not a lot of comparison data. So we're starting to work on maybe inspiring others to collect this data too. And we would hope, since we already did all the hard work of making the instrument and testing the questions, and I know it's not perfect, but if people want to borrow some of those questions for their own community assessments or their own assessments in their organization, that would be great, because then we could continue to build that data, right, and see trends in our community and with different populations.
Yeah, and for this survey, of course, you can at least compare between regions with those fact sheets to, what the informal food pathway engagement is, in Baraga County versus Ontonagon as an example. But yeah, there's not a lot of data outside of the survey that we can compare it to at this point.
Yeah. Dr. Liu?
Yeah, I'm thinking for future research, because currently our survey is mainly about the food security and hasn't been linked to people's respondents' health. I think next topic, maybe we can ask both their food security, informal foodway engagement, and also their public their health situation. I think that would be more a direct link between the food security and the public health.
Yeah, it would be interesting to look at a lot of the outcomes or impacts of the informal foodways engagement, right? Because there's public health impacts, there's also local economic impacts, right?
And also health, if we have asked the question if you have health insurance, and 95% of respondents said yes.
Yeah. So yes, assessing the public health, the economic contributions, community cohesion, however we would want to measure that, but thinking about how people, in going to community gardens or going to farmers markets are having maybe more social interactions than they might have otherwise and doing these things alone. These are all benefits that these activities have to our communities, right, that are important as we continue to plan our programs and policies.
Okay, Michelle has a question about how many respondents. So the mail-based survey, we had 231. And for the online, it's about 400, total like 679. Yeah.
Thanks, Hongmei.
Yeah, thank you. There was a question in the chat from Rachel, and it said, is there any possibility to include some of these questions in future editions of the UP Community Health Needs Assessment? And that's done by the health department. I won't speak for you, Angie. I would hope so, but I don't know. I think that would be a question for those.
For the health department.
Yeah, for the people leading that. But we would love to see that. We're hoping it's an open source that people could use. Would be a great opportunity to watch those trends. I don't know if you have further thoughts.
Right now, the only question on the health needs assessment that asks about food, asks about servings of fruits and vegetables consumed per day. And that includes, for example, like a glass of orange juice, like juice is included as a serving of a fruit or vegetable. And that's interesting, but it doesn't maybe tell us a lot about the rest of the systemic involvement, right? And the engagement of that person in the food system, or where that food comes from, or why they're making those choices that they do. It's hard in constructing a survey because everybody wants to put all their questions in your survey, and you need to keep it manageable for people to do in maybe 20 minutes, no more. And so it's hard putting together a survey. So I can imagine that the health department and organizing their UP-wide community health needs assessment, that this is really tough to know which questions to include. I would hope that maybe we could incorporate some of these questions in more regional assessments like that.
Yeah, I'm also thinking about the policy implementation, because some people mentioned that they are interested in raising livestock in their backyard, but because of the zoning restriction, they are not able to do so. And also the transportation issue, especially in the winter, many people with transportation and the utility fee, these are the two most significant factors that impact people's food insecurity in winter. So maybe in the winter, we can have some more public transportation to food stores in winter.
Yeah. And it really highlights like the intersections, thinking people might silo transportation, food, energy costs as like different areas of work. But we see how these are really interconnected when it comes to people's lives, right? And our community health. And one way that shows up is in food security or insecurity in our communities. Yeah, we saw that in the survey responses.
I have another question. What other plans for outreach do you have on this amazing tool? Are you planning to write a paper or present at a conference? I would love to see other rural regions be able to utilize this tool.
Yeah, we are working on a paper. Hongmei and I are working on a paper that's very close to being able to send out for review. And then there'll be at least 2 or 3 other papers from this data. For example, we've had conversations with Dr. Kelly Cam specifically about the informal food waste data that we have and how excited she is, because people often equate like how many hunting licenses are sold with like that is people doing those activities for food, but it might just be recreational, right? That people are engaging in some of these activities. And we asked specifically if they were doing this as a food related activity, as a food source. So she's interested in digging into some of that data, and we welcome collaboration with others who are interested in, it doesn't have to be a paper, it could be a fact sheet, it could be presentation, a lunch and learn. We really hope people will reach out to us for opportunities to share this within the community. But we will also have some formalized, people like to see the scientific journal articles for the science, that we will have to back all this up too. So we hope that it is validating for folks, because I think none of this is probably a surprise. You've heard it or you've seen it in the work that you're doing in communities. But being able to say now that we have this regional data, right, that supports the anecdotal evidence that we've seen is really important.
I'm also thinking about the methodological issue, because we bought about 1,000 data address from a company to send out mail for a survey, and ultimately we get 231 responses, because some addresses are wrong, some people have moved out, and so I'm thinking for future survey or similar survey research, we maybe really needed to double or even triple the sample size, because currently we send out 1,000 mail, and with a lot of incentives and encourage people to take the survey, but still not so many responses from the respondents.
This is part of the data justice issue, and I know in talking with people who are involved in the community health needs assessment, it's really hard surveying our populations up here. We have a lot of people who might not be year-round residents. We have a lot of information that might be out of date. Our civic people who are employed in different positions in our city and county governments may not have the capacity to update all the things. They may be under-resourced. So yeah, reaching people to get the data is a challenge here, and in a unique way that maybe it's not even in other rural areas, just because of the remoteness of our region. So that's something definitely that is important that Hongmei brings up to talk about together too, as we do the research together, how we can continue to try to make sure that we're reaching people, that we're getting enough response back.
And that actually is a great segue. One of the questions was how many total respondents? And I know you might have mentioned that earlier, but do you mind resharing that?
It was like, Hongmei, was it?
231 from the mail-based survey, and we sent out altogether 1,002. And for the online survey, we get 448.
And that was anybody could complete it who wanted.
Yes,
and so the people often talk about when you do a mailed survey like we did, the response rate. And so our response rate was 35%, which is not bad, because many of us today are inundated with things in the mail. Things get set aside as junk. People don't pay as much time anymore to filling out surveys that get in the mail, which is why we use this method where we sent them actually 5 mailings so that they would know it wasn't junk mail. They would know why they were invited. They would get a reminder postcard. Like, these methods are tested to try to improve your response rate. And so we use those. But 35% is pretty standard anymore for a good survey response rate. We tried as best we could to tailor it to the population. We did pilot testing of all the questions with community members and got their honest feedback about what questions were confusing or different words to use. And so, there's always things to improve. But I think we're always all learning how to do better in getting the data that we want and need. It's part of the project. And hopefully by seeing this data and hopefully seeing it inform things in their community, people are more excited, eager to share their thoughts on this stuff too, right? Yeah, other questions, comments? But if you have ideas, Rachel, for further promotion or outreach, holler. Let us know. Anyone has ideas, let us know.
Definitely have some ideas. I'll be in touch.
Yeah. And I think we'll get, I'm not sure if it's posted there right now, but we're glad to share the survey instrument with anyone. And so once you get a chance to look at it, if like question 34 is really exciting for you, we could come and just talk about how people engage in informal foodways, like we can tailor the outreach to whatever your group might be interested in from the survey. Great.
All right. Any other questions, parting thoughts, comments?
Rachel, I know in your planning process, you have already encouraged or incorporated many community gardens in several counties planning or cities planning. So, and also on your website, on your WordPress official website, you have specifically highlighted the food system planning as the category that WordPress can do for the city planning. So I expect the planning department will play a more important role.
Thank you, Dr. Liu. I definitely expect that as well. I really appreciate all of your help on this project.
You're most welcome.
Well, thank you all. A lot of you have been involved with this, some of you from the very start. It's exciting to see it out in the world and to share those fact sheets, and look forward to talking with some of you more about this data as we continue to apply it and build upon it in our work.
Yeah, and I think our last thing that we would just wish to thank the following partners who were so instrumental in this project starting and continuing and to the point where it is today. So we wanted to thank Dr. Kelly Kam, who's with Michigan Tech. As we mentioned, she was part of the original question bank development, as well as the Western UP Planning and Development Region, WPDR. Dr. Hong Mei Liu, thank you for all of your hard work, getting all of this, the instrument co-developed and then the analysis of the data. I'm sure that was no small feat. For Copper Shores Community Health Foundation for funding the survey, Western UP Food Systems Collaborative for the survey instrument co-development and feedback, and then the Western UP community residents for participating in the survey. And this last slide, I know a couple people asked, I think if we go the other way, that's okay. I think if we go one more. This should have our information here as well. So if anyone's looking to get in touch with either Dr. Angie or myself, we'd be happy to connect and talk more about any questions you might have or specific data sets you want to look at. So please feel free to reach out at any time.
All right. Have good weeks.
Yeah, thank you so much for listening and for all that you guys do.
Thank you all. Thank you for our sponsor.
Bye, everybody.
Thank you all. Great work. Amazing.
Thank you. I'll see you guys.
Bye.
Bye.
Bye, Cindy.